Cybersecurity is more important than ever nowadays, so with that in mind, let's talk some cyber. There's a lot to unpack here, so let's start with two very basic definitions. What is cyber liability? Cyber liability covers data breaches, digital security issues, cybercrime, and hacking. And this leads us into our next very simple definition. What is a data breach? A security breach is an unauthorized access of data, devices, networks, applications by bypassing the proprietary means of security. Now keep in mind there's multiple definitions of what a security breach is, but that's the most comprehensive one we could find. The American Medical Association did a study and they found that for every data breach you have, it could be up to $50,000 per violation or an average of $1.5 million per year. With all that in mind, there are three things you should be asking yourself about your cyber liability policy. One, does my policy cover HIPAA fines? Two, is my defense cost inside or outside of the limit? And three, does my policy cover extortion or ransomware? If you can't answer any or all of those questions, then you should be having a conversation with somebody that is well versed in cyber liability. Now remember, there's over 2,400 different forms of cyber liability. So there really is no underwriting standard for any policies like this. So it's honestly up to the purchasing team to make sure the coverage that they get is what they need. Cyber liability is relatively new to the marketplace, so there's a lot of gray areas that lead to coverage gaps. So what can healthcare providers do to ensure they're purchasing the right insurance? One, you start with a risk assessment. For the risk assessment, you're going to want to know things like where the data is housed, what the incident reporting looks like, what the disaster recovery program is, and any other security measures you might have in place. You just want to make sure that you're holding up your end of the bargain as a provider, or claims may get denied. In the event of a breach, carriers will most likely work with your organization by providing their own forensic team. Each carrier has their own way of handling the investigation, and they're generally hyper involved. The healthcare sector gets hammered every single day by cyber attacks, so what we went over today barely scratches the surface. The best way to approach cyber liability is to dig your well before you're thirsty. Be proactive, do the research, do the risk assessment, and make sure you're getting the right coverage. The benefit of working with a broker that has experience in the healthcare space like Metropolitan Risk is we have the unique ability to benchmark where you were, where you are now, and where you're going so we can deploy resources as needed. Remember, you can't manage what you can't measure. One last thing for healthcare providers, there is a new protocol for reporting a breach to the Department of Labor. You'll find the instructions in the link below. Thanks for watching and have a great day.